Hi, this is David Mastio, California editor for the Center Square, and this is California in Focus. As always, I'm joined by Kenneth Schrupp, a California reporter for the Center Square. Today we're talking about the costs of Medi-Cal for illegal immigrants. First, Kenneth, what is the argument Democrats make for covering undocumented immigrants?
The argument they make is that illegal immigrants are paying sales tax even if they're being paid in cash and not directly supporting the Medi-Cal system through other direct employment taxes. Second, they argue that healthcare is a human right and that no one should be excluded from the state's taxpayer-funded healthcare system. Medi-Cal is the system that covers low-income Californians. We also have Medicare for older Californians over 65.
How much will it cost to cover these undocumented immigrants, and how many immigrants are we talking about?
California itself estimates that there will be about 700,000 users added to the Medi-Cal system, but given that we really have no idea how many illegal immigrants are in California, that number could be several times higher in the end. Republicans estimate that illegal immigrants will cost California about $4 billion next year. This is coming up against our $68 billion deficit we have for the year.
What are the risks of expanding coverage to more illegal immigrants right now?
Right now, the biggest risks are with making sure that Medi-Cal has enough doctors to treat all of the people currently in the system. Medi-Cal has much lower reimbursement rates than private insurance, as one would expect. A lot of doctors take as many Medi-Cal patients as they can because they think it is a social good. But the reality is that a lot of doctors are feeling financial pressure to no longer accept as many Medi-Cal patients or not even accept Medi-Cal in the first place. Costs of living are going up, and Medi-Cal reimbursement rates are not keeping up. At the same time, we have this $25 minimum wage for healthcare workers that's going to put even more pressure on the overhead for doctors. So they're going to either have way fewer patients for Medi-Cal accepted, or more likely, they're also going to have far fewer nurses and other staff to take on new clients. And we're going to see, even without this increase in the number of users from illegal immigrants, major pressure on the Medi-Cal Medicare system in the state.
Does the declining number of providers mean that people on Medi-Cal are going to have to wait longer for care? Is this going to be a Canada kind of situation?
Well, as I said earlier, even if there were not the addition of a huge number of people for eligibility, that you would see rising wait times and fewer doctors. Adding more people is going to make those growing wait times even worse.
What do Republicans say should be done?
Well, one Republican assembly member has put forward a bill suggesting that we, quote, revoke all taxpayer funding for healthcare for illegal immigrants in the California state budget. State Assemblymember Bill Essayli estimates that it will cost us about $4 billion this year.
How likely is that to happen, given the small minority that Republicans make up in the legislature?
I would not say that it's likely to pass at all, but if we're going to be completely honest, it's going to be very hard for the state to come up with places where it wants to cut money. We already took a lot of emergency measures last year to meet the $32 billion expected deficit compared to program spending. And through a combination of minor cost reductions, but mostly in one-time deferments of spending, we were able to meet our 2023-24 fiscal year spending requirements and revenue requirements. But I don't see how we're going to be able to do it this time.
Are there other potential cuts as big that would be more palatable than targeting undocumented immigrants?
At this time, nothing of this scale has been proposed by either party.
Are other states following suit or considering following suit with what California has done? Is this a trendsetter situation with California?
Nationally, most of these sanctuary states and sanctuary cities are providing healthcare, housing, a whole number of language and support and other social services for illegal immigrants. And you see New York City alone is spending billions of dollars a year on their migrant programs. It's becoming quite expensive to maintain this, and I don't know if there's voter appetite for this in the long run.
California is a very blue state. Could it be that this is politically popular?
I don't think that this decision is sustainably politically popular. If you look at the attitude in New York City, Eric Adams is a staunch, lifelong Democrat, and he's calling illegal immigration a very serious problem because of what it's doing to a city's finances. And a lot of New Yorkers are understandably upset. I would read this quote to you from the assembly member who proposed this bill, which I think would capture what a lot of Californians feel, Republicans, Democrats, and independents alike. It is unconscionable to spend billions of taxpayer dollars to give universal health care to illegal immigrants when our own citizens cannot afford their own health care on top of historic inflation and the highest cost of living in the nation. The guy also noted that healthcare insurance premiums paid by Californians in the private market increased by 9.6% in the last year.
I'm David Mastio with the Center Square, and we've been talking with Kenneth Schrupp, California reporter for the Center Square. You can read his work at thecentersquare.com. Thank you for listening to California in Focus, and please subscribe to our podcast.
Are you tired of news that puts politics over people? At the nonprofit Franklin News Foundation, we believe in putting people over politics by delivering nonpartisan news and audio content that serves you, the American taxpayer. With Franklin News Foundation, you can read fact-based, state-focused news for free at thecentersquare.com. You can listen to civil, balanced conversations between policy experts through our podcast network at americastalking.com. Or you can get in-depth news on K-12 education spending, curriculum, and school safety at chalkboardnews.com. It's all free through Franklin, where we put you, the American taxpayer, first in every story, episode, and conversation. And it's only possible through our supporters. Together, we can produce content that puts people over politics and brings Americans the news they deserve. Become a supporter today at franklinnews.org/donate. Once again, that's franklinnews.org/donate.